But the fire department has suffered from an inability to effectively educate elected officials and the general public on the dangers and consequences of opioid abuse. The majority of city officials and citizens don't realize the prevalence of opioid abuse in the community and its devastating effects. This perception leads many to believe that opioid abuse is not a problem, and to address it would drain limited city resources. Of a much higher priority are fire and EMS incidents, which are viewed at a higher priority than opioid abuse. Budget requests from the fire department to combat opioid abuse are viewed as highly speculative and given lower consideration than other department requests. The fire department needs a way to show the debilitating costs associated with opioid abuse to the elected officials of our community and you, the citizens that they represent. In just this past year, we've had 5 opioid overdose victims receive Narcan, which is an opioid overdose medicine, at our city fire stations. The problem is real and it's growing at an alarming rate. The recent rise in unemployment has run parallel to this increase of opioid overdoses in Columbus, Mississippi. Opioid overdoses have taken the lives of people regardless of their social status, although these deaths do appear to be at a higher rate among those with lower education levels. An opioid abuse education task force would educate all involved and work to change the misconceptions surrounding opioid abuse. This in turn would assist the department in gaining much needed resources to address this issue. The Opioid Abuse Education Task Force would also raise the awareness of the department services that are offered and increase support for the rehabilitation of those affected in our community. Opioids are highly addictive drugs, and they're primarily used to reduce pain when prescribed by a physician. These substances include drugs such as those prescribed oxycodone, hydrocodone, morphine, fentanyl, and others. They also include the illegal opioids like heroin. Community collaboration is essential for success in preventing these opioid overdose deaths. Medical personnel, first responders, mental health, substance use treatment providers, and the community come together to all bring awareness, resources, and expertise to address this complex and fast-moving epidemic. An opioid abuse education task force would educate all those involved, work to change any misconceptions surrounding opioid abuse. This in turn would assist the department in gaining much needed resources to address the issue during the city's budgeting process. From 2015 to 2016, opioid-involved deaths increased in males and females nationwide among persons aged 15 and older. This includes people of all races and every subgroup. The time to address the opioid overdose crisis is now. This opioid abuse education task force is our first step towards reducing this growing community risk. Nearly 450,000 Americans died from prescription and illicit opioids in the 10-year span between 1999 and 2019. Opioids were involved in nearly 47,000 American deaths in 2018. This is 6 times the number of opioid overdose deaths in the year 1999. In our state, home state of Mississippi, nearly 60% of the 310 drug overdose deaths in 2018 involved opioids, a total of 173 fatalities, a rate that's about 6-1 increase. Risk identification and prioritization are generated from several different sources here in Columbus in our department. Here at the fire department, we have a accreditation officer, and he takes hazard analysis forms, run report data that's generated every time we go on emergency calls, and he gets those questionnaires that we come out and we spread out in the community and we get back. And he compiles an annual compliance report. This annual report is submitted to the fire chief for approval before it's submitted to the Center for Public Safety Excellence for acceptance every year. In this annual compliance report, you'll find details on many things, but chief among those are the risks confronting our community and your fire department's efforts to address them. These risks were identified by internal department processes, community stakeholders such as yourselves coming in and letting us know what's going on in the community, and the public safety excellence accreditation peers that come in every 5 years and view our community. Identified risks are prioritized based on frequency of occurrence and community impact, then forwarded to the department member or the committee assigned to that particular concern. Quarterly reports detailing time-specific goals addressing those risks are also forwarded to the accreditation manager, who includes them in that annual compliance report that we were talking about. This method of identifying and prioritizing the risk aids in tracking our objectives as we progress towards obtaining the goals. So why am I telling you all this? We actually have gone through this process, and looking at that annual compliance report, opioid overdose deaths have really increased in our community, and the data is showing that. The majority of these community risk assessments are done by collaborative groups. That is, groups that we go outside of the fire department that have similar goals of reducing community risk. During those committee meetings, we have robust discussions on critical opinions, and we try to avoid getting into what's called groupthink or group thought. And whenever that happens, when certain people in the group take over the conversation, or the group starts going towards one conclusion because they think it's going to speed the process up, that decision-making process definitely is shortened, but it increases the chances of mistakes and oversights. Usually it's a ranking individual in the group, and he's putting forth an opinion, and then the group just takes that opinion and then runs with it. But we avoid this in our department, in our city, by keeping those committee sizes small. We also like to have a diverse group, and that's why we come out in the community with these issues as they come up, and we get those that are involved to become parts of our committees. You are what's known as our external stakeholders. That is, you're people outside of the department, you're in the community. These issues affect you, so you have a stake in seeing that they are mitigated. Those mitigation strategies to combat the problem that we're addressing today, which is opioid overdose, it began with a review of that data from the annual compliance report. The key to that process was identifying conditions in the community that contributed to the opioid overdoses. So it was helpful at this point to develop problem statements in the committee for each of those contributing conditions, the things that led to opioid overdose. Viewing those statements made it easy to see common themes that may be in between them. And then we could break them down into how we mitigate these problems, measurable goals that could be attached to them. One of the mitigation strategies we came up with was referral of the self-reported opioid abusers to substance abuse professionals. A measurable goal for this strategy was to have a substance abuse professional contact that individual within 24 hours of their referral. That goal could be monitored for progression towards completion. Emergency response intervention strategy was the most beneficial, what we found, because it focused on having appropriately trained responders identify and treat that opioid overdose victim. Also, at this stage of the intervention, we could refer them to post-care action, usually here at our local hospital. Mitigation strategies developed to address these opioid overdoses, they all really center on education and treatment. Education and treatment strategies really center around the forming of that opioid abuse education task force. It brought together individuals that have firsthand knowledge of the problem, and they usually offered effective mitigation strategies. We talked about the self-referral of the opioid overdose victim, but the task force went a little further than that. We started to looking at what brought about these opioid abusers, what brought them into contact with that drug. And we started to see some common themes among them. We saw that we needed to really target like their family members and their friends who were also substance abusers. Community youth with a history of criminal activity are also targeted here in Columbus. We hit them with education that's designed to inform them of the dangers of the opioid abuse. Community leaders, constituents, they're also targets for our opioid education task force. People such as yourself, which is the reason that I'm here today. We want you to receive the information on what these opioids are, how their abuse destroys the prosperity and the security of our community. One of the most successful methods of creating buy-in is with our opioid education task force is me coming out and speaking with groups like yourself today. Also, what I would like to put the power in your hand is that the power of word of mouth. I want you to go out and talk about what we viewed and what we spoke about here today. Community risk reduction is all in our benefit. Opioid abuse is just one of the problems that is facing our community.